Hi, this is Dr. Hussain. We are now continuing our series on hair loss and hair loss treatment and other aspects of hair loss. Today we are going to talk about medical hair restoration, non-surgical hair restoration. What we need to keep in mind between these two options of surgical and non-surgical hair restoration is that non-surgical hair restoration should be compared to having a treatment for diabetes or hypertension or asthma. We don't do away with the actual reasons for the hair loss, and you have to continue the treatment, whether it's a daily, weekly, monthly or quarterly treatment. You still need to carry on with the treatment for the effects to last longer. If you stop the treatment, the effects of the treatments will fade away. This is opposed to the surgical solution where we actually move hair that is more viable, that is resistant to DHT. We are moving it from the sides of the head, from the back of the head or beard, or from the body. We are moving body hair to the scalp, and that hair is by default not sensitive to DHT, which means it can carry on producing hair. Those follicles can carry on producing hair, and that's a major difference between medical hair restoration and surgical hair restoration. Medical hair restoration, non-surgical hair restoration requires follow-ups, and if you do not follow up for one reason or the other, it will have an impact on your hair. You will start losing your hair again. Okay, so non-surgical hair restoration, we got a number of options, and these are not all the options that are available. Particularly I would need to mention that in case of disease-specific hair loss or hair loss due to drugs or certain conditions, we need to look at the underlying cause rather than trying to bring in some new treatment modalities. But these options that we're going to present today are the hair loss treatments that would be mostly relevant in patients with male pattern baldness or female pattern baldness, where we don't identify any underlying cause, or if there's no correctable underlying cause. It has to be assessed in each and every patient whether or not this is a case for medical hair restoration or not, whether or not we should do hair transplantation or not. So it's not like you can just opt one of these treatments and things would be okay. It's just like diabetes medicine or hypertension medication. You cannot just pick one and believe that would be the right treatment to have for each patient with hypertension or diabetes. So we have to assess the individual case. We have to look at what is in favor of this medication, what is against this medication. We need to look at the pros and the cons. Anyhow, we'll start out with the treatment options. There are a number of options that we'll touch upon in this video. In non-surgical hair restoration, we have platelet-rich plasma, microneedling, Minoxidil, Finasteride and dutasteride, Ketoconazole, disease-specific treatments, and we got other treatments also. So let's start out with the platelet-rich plasma. Sorry, before we start with the platelet-rich plasma, I just want to say that medical hair restoration is especially relevant for men with hair loss in the crown before the age of 35. At my hair clinic, we strongly believe that we should be conservative and not take a risk regarding future hair loss. And we are quite reluctant on doing a hair transplantation on patients that are less than 35 years of age and has hair loss in the crown area. This is for men. It's also very suitable for patients with hair loss but with a very poor donor area. Regardless of the age, It's and regardless of the gender, for men and women with a poor donor area availability, medical hair restoration is very relevant. Also for women, with men we can still use beard and body hair. With women the availability of body hair is quite limited, so we have to stick with either medical, surgical or non-surgical hair restoration, and the surgical option is more or less confined to scalp hair as a donor area. We can use pubic hair, but still it won't usually give sufficient donor hair for that purpose. The treatment protocol for medical hair restoration vary greatly. There are certain treatments that needs to be taken daily, twice daily. For instance, Minoxidil is used twice daily. Another medicine is once a day. Yet another treatment is weekly in-office treatment. Other treatments are like monthly for initial course of treatments, and after that quarterly treatments. So the treatment protocol for each and every medical hair restoration procedure varies greatly. Well, let's move on to platelet-rich plasma. There is a great deal of hype in platelet-rich plasma. Quite a few patients have heard about it, that you can have these injections with your own blood or your plasma and it will regrow hair. Platelet-rich plasma has a very long history in medicine. It has been used for quite a few years now in sports medicine, injury medicine, and there was a tendency towards faster healing in patients receiving platelet-rich plasma. From sports medicine, it moved into aesthetic medicine. Its most famous application is probably the vampire facelift, where it's combined with microneedling and platelet-rich plasma is injected into the scalp also. It has in the recent years, in recent years, platelet-rich plasma has moved into hair restoration, and it's increasingly being used for restoring hair in patients with that opt out of the surgical treatment, or with insufficient donor availability, or if the age is such that they should not have a hair transplantation. So before we go into the depth of platelet-rich plasma, I need to explain something. Platelet-rich plasma and the platelets actually, and the growth factors that we find in the plasma, they have a certain importance. When you have an injury to the body, if you have a cut or wound, the first cells on the scene to take charge are the platelets that helps creating hemostasis, stopping the bleeding. The platelets, along with the other factors that come into play, would then make an assessment of the situation and call in all the resources required to deal with this injury, this trauma, this cut, whatever it is. If there's a need to rebuild the skin, the blood vessels, to repair the cut and so on, the relevant cells would be called in to do their job. So it's actually a kind of taking charge of the situation, the emergency management team that steps in and calls in the resources that are required to deal with the incident. As part of that repair process, when you have this injury or trauma, also the hair follicles are stimulated, and those hair follicles are then, and the dermal papilla is stimulated, leading to hair growth then. The precise treatment plan would be set up after a live assessment. Right now we'll just go into some few of the studies. It's just a brief touching upon the subject. Some of the studies that are available. There was one study with 10 patients that received platelet-rich plasma, and after 3 months of treatment, all 10 patients had good growth. And 3 of the 10 patients complained of headaches, mild headaches, after the initial procedure, and it was treated with paracetamol. Other than that, they didn't have any side effects. We have another study with patients receiving a PRP every second week for 4 treatments, and the outcome was then assessed 3 months after the treatment. Before the treatment, the average count was 71 follicular unit per square centimeter, and it increased up to 93 follicular units per square centimeter. So a gain of 22 follicular units per square centimeter, so 31%. I just need to add something. Although we have the study and we've seen it, it says follicular unit. I believe probably the authors meant to say hairs and not follicular units. I'm not sure though, but from the study it says follicular units. I believe it's hairs, as I have a hard time them being able to count actually the follicular units. Anyway, regardless of whether it's hairs or follicular units, the increase was 31%. This is then one picture that followed that article. It shows quite a good, remarkable growth. Unfortunately, I think it's a kind of unfair or not reasonable to give the picture with probably the best possible results from this group. Keep in mind, 22 hairs per square centimeter, so 31% growth. It's an average. So if one patient had 10 hair and the other had 22 and the third one had 34, so the average is 22, but there's a great difference between the results that the patient with 34 hairs is experiencing and the patient with 10 hairs. Likewise, if we had one patient with no growth at all from PRP, another one with 22 hairs per square centimeter additional growth, and yet another patient with 44 hairs per square centimeters, we still have an average growth of 22 hairs per square centimeters. So unfortunately, I'm afraid this picture that was presented in the study is probably, it's reasonable to assume, is probably the best case scenario kind of picture. Anyway, what it goes to say, nevertheless, it shows quite clearly that PRP has a place in hair restoration. We'll then move on to microneedling. Microneedling is a very controlled trauma to the scalp. There are various different treatment protocols, and there's really no final verdict on which protocol is the best one. Again, microneedling is also a treatment that is widely used in aesthetic medicine. It can be used for skin rejuvenation, it can be used to treat stretch marks, it can be used to treat acne scars, and generally also bags under the eyes can be treated with microneedling. So we do have quite a bit of experience with microneedling affecting the skin. And the hair is a part of the skin, and there are studies that show actually that there is an increased expression of certain hormones involved in hair growth when microneedling is applied to the scalp. So microneedling has studies to back it up, and this one study I'm going to present now is a study where microneedling was combined with the topical treatment called Minoxidil. 2 groups of patients were set up. One received microneedling with Minoxidil, and the other group of patients had only Minoxidil treatment. The microneedling group had weekly microneedling at 1.5 millimeter depth, and the microneedling was carried on till there were mild erythema in the scalp. This was 1.5 millimeters and a weekly treatment for 12 weeks. The remaining 6 days, the patients would use Minoxidil twice daily for 6 days a week. For the first 24 hours after using microneedling, Minoxidil was not applied. Again, the other group had only Minoxidil. The group of men that were chosen for this project was men in the age of 20 to 35 with mild to moderate hair loss, and the outcome was assessed 3 months after the treatment. So after 12 weeks of treatment, the outcome was assessed another 3 months later. Sorry, it was assessed at 12 weeks. At 12 weeks, the growth was significantly higher with the group of patients receiving Minoxidil with the microneedling. Microneedling with Minoxidil, and there was a growth of 91.4 hairs per square centimeters as opposed to 22.2 hairs per square centimeters. You can see from the picture that it's quite clear that the two patients that presented in this study, they had a very remarkable growth from microneedling and Minoxidil. There is some change to be seen in the two patients with with Minoxidil only, but clearly the greatest results are seen with microneedling and Minoxidil. In this study, there wasn't any use of platelet-rich plasma. Now, the next natural subject would be Minoxidil. As we discussed in this study, one of these groups with microneedling and Minoxidil, the other group had only Minoxidil. They had 22 hairs per square centimeter additional growth. Minoxidil has been around for many years, and it has a proven track record. Roughly around 40, maybe 50% of the patients would have some benefit from Minoxidil, maybe even more. There's a tendency to many patients to stop Minoxidil after 2-3 months because they believe it didn't help much. But with medical hair restoration, it's not unusual to need to take treatment for 6, 8, 10 months even. So the variation in the response to Minoxidil could partially be due to the studies being carried out for too short a period. Anyway, Minoxidil has been around for many years. In most Western countries, it's sold as Rogaine. We do have other trade names. For instance, in Pakistan, it's sold as Hairmax Plus and is sold as Minox. It's a liquid spray that is used twice daily, and abroad you can also find it as a foam formula. I'm not sure if it's available in Pakistan as a foam formula. It can be used by men and women, and it should be applied not to the hair, it should be applied to the scalp. What we want to is the maximum absorption and uptake into the dermal papilla, the hair follicle. We need to bring the medicine in there where it needs to work. So we don't want to apply it to the hair. You actually part the hair and you apply it to the scalp in the parting. Common side effects with Minoxidil is headaches, irritation and oily skin. Now, moving to the next medical hair restoration, we have Finasteride and dutasteride. As you may know, one major culprit in hair loss, in most forms of hair loss in men, roughly 90% of men would suffer from androgenic alopecia, male pattern baldness. In other words, The major issue here is the sensitivity in the follicles of the front, top and the crown area to DHT, dihydrotestosterone. Now, dihydrotestosterone is made from testosterone. Testosterone is produced in the testicles in men, and through the effects of type 1 and type 2 5-alpha reductase enzymes, testosterone is converted into dihydrotestosterone. Now, the hair follicles can stand, the hair follicles in the front, top and the crown has a varying sensitivity to DHT. The sensitivity is not just about the level of DHT, it's also about duration. Some of the hairs may be very sensitive to DHT, and even a short time exposure to DHT at that level would lead the hair follicle to shut down production of hair. So those hairs will fall early, say in some patients even as early as their late teens or early 20s. Some hairs may be maybe less sensitive, and that hair may fall later in life, in the late 20s, early 30s maybe, and some may be even very stubborn, and they may fall in the late 50s, 60s. The hairs on the side of the head, the beard, the facial hair, the body hair, is not really bothered about DHT. It can take DHT, it can stand DHT, it's not really something that is prone to hair loss, which is also why we can use it for hair transplantation. Anyhow, as I said, there are two enzymes involved in the production of DHT from testosterone. Finasteride reduces the activity and it inhibits the type 2 enzyme, type 2 5-alpha reductase, which means the production of DHT is reduced. And as the production of DHT is produced and the amount of DHT in the scalp is reduced, more follicles kind of wake up again. It's like a factory has been shut down, and now someone opened up the factory by reducing the amount of DHT and the factory is then starting to produce hair again. And other factories that were maybe in the process of shutting down, they realize, well, okay, the DHT level is down, so we can start production again. So the hair follicle starts producing hair again. So as the level goes down, we have the newly dormant follicles can start producing hair, and if the level is sufficiently down, it can bring quite a good regrowth and also stop hair loss. The response to finasteride will naturally vary from patient to patient. Dutasteride is a newer, but not very new, but it's a newer inhibitor of type 1 and type 2 5-alpha reductase, and thus it's a stronger inhibitor of it more strongly suppresses the production of DHT. Dutasteride has not been approved for hair loss treatment. Finasteride has been, and it has been around for many years. It's a 1 milligram tablet that's taken once daily. Now, I'm mentioning these two medicines is not kind of a recommendation. I usually never put a verdict on this, whether the patient should take it or not. The main issue here is we do have some problems with the side effects. Although there are no studies to confirm any permanent side effects, if you do a search online, you'll soon realize there are some patients reporting that I used finasteride for a while and it led to permanent side effects. And the side effects that we're talking about is impotence. Impotence is a lack of erection or weak erection, not enough to carry on with the satisfactory sex life. Or it's decreased libido, can also be caused by finasteride, in other words, decreased sex drive. It can also lead to pain in the nipples and the testicles. Now, From the studies that we have, we are looking at 2 to 3% of the patients may experience this, and usually if they carry on with the medicine, the side effects go away. For instance, we had a patient who had the morning erection was gone. We reduced the medication, and after some while it came back, and increased the doses again. However, the reason I'm not putting any recommendations on finasteride and dutasteride is that there's reports are coming in from patients that they had permanent side effects, they had permanent decreased sex drive, or they had permanent impotency. My personal opinion is that as we don't have any scientifically proven evidence, we don't have any scientific evidence that this is actually the case, I tend to believe that the reasons for impotence or decreased sex drive could be something else. And it could vary from patient to patient, but because they took the medicine, it's easy to draw the conclusion it's down to the medicine. On the other hand, around quite a few number of patients with, for instance, diabetes in their 40s, they would be impotent. It's quite common with increasing age to become impotent. And patients that may start using finasteride at age 25, and maybe at age 32 they may realize, oh, I feel it's not the same erection that I had when I was 25. They may feel that this is down to the medicine, but again, the studies we have do not confirm this. It could have been that they would have had this issue regardless of whether they were using finasteride or not. Anyway, I leave it to the patient, because I understand to live with any side effects like impotence or decreased sex drive would greatly impact the quality of life for most people. So what I do is I present the information that we have, and I would be happy to answer any questions regarding this, and ultimately I believe it's the patient who has to make up his mind to whether to use this medicine or not. So we're talking about men here. Women can use, normally we do not recommend finasteride for women, especially because it can lead to malformations of the genitalia of the fetus. However, in some cases, finasteride has been used for women that are sure not to get pregnant, or for women that are out of the childbearing age. Every patient has to be assessed individually. There can be circumstances where we would do it if there's a great psychological impact from not having hair. We would be willing to do more treatments than if it's just a small bother, something that you think of on and off, and really it doesn't affect your quality of life. Anyhow, it has, as with all treatments, it should be assessed individually, and the decision whether to go for platelet-rich plasma, microneedling, minoxidil, finasteride, or other medicines should be taken after consulting a doctor working within this field. Dutasteride, there's too little information about dutasteride. There's not sufficient studies for me to be able to recommend dutasteride at all. I'm mentioning it here just for your information. I would not at all recommend dutasteride. We don't know for sure what the half-life of dutasteride is. So my verdict on dutasteride is I would be very reluctant on using it for hair loss. Anyhow, we'll just very briefly mention ketoconazole. Ketoconazole, the trade name is Nizoral, and it's used for fungal infections in the scalp, and fungal infection can also lead to hair loss. It can also be used for dandruff. It comes as a shampoo, and again, if it's assessed that you are hair loss is down to a fungal infection, then obviously it would be relevant to consider Ketoconazole or Nizoral shampoo. Again, as I mentioned in the very early stages here, we need to make sure we are not treating something that has a correctable cause. In maybe around 90% of the men, we can't, from a clinical assessment, conclude that, okay, this is probably most likely going to be male pattern baldness, androgenic alopecia, and would have to then look at what are the reasonable treatment options available in this particular case. You can't just take any treatment and say this is probably good because someone else used the same treatment. It has to be assessed in the individual patient. After the initial assessment, for 90% of the patients we can do it like that. For 10% of the patients we might be looking at some underlying disease condition, correctable cause, hormonal imbalance, iron deficiency, other issues. We need to correct that before we look at doing any kind of medical hair restoration. For women, it's a bit more tricky. It's more likely we'll find an underlying condition. It's more likely women could have PCO, they could have hormonal changes, they could have other diseases, they could have heavy periods leading to iron deficiency and anemia. There's no point in going into platelet-rich plasma, microneedling, minoxidil, if actually the cause is somewhere else. We actually need to correct the bleeding. The contraceptive pill may be relevant in that case to try to control the periods. It could be relevant to a coil treatment to try to control the bleedings. Again, if there's any underlying disease or condition, we need to treat that. Just taking anyone looking from results on the internet that this guy or this girl had tremendous results from this treatment, it does not necessarily mean that each and every patient should go for that, even if the other patient had a very good result from that. As far as disease-specific issues, there are a number of diseases we can look at. For instance, thyroid can cause hair loss, and I think we'll take that on another day. This is actually this finalizes our video on medical hair restoration. If you have any suggestions and if you have any input, if you want us to make a video on a particular subject, then you're more than welcome to write us at info@myhairclinic.com. You can also contact on mobile or WhatsApp +92 3211 554 554. This is our mobile number, and we are also available on WhatsApp on this number. If you have any suggestions, please do write us. If you want to come for a consultation, you're more than welcome to contact us, and we'll do our best to help answer your questions. Thank you very much.